Hello, I will be doing a short presentation about my research paper for women's employment in Serbia after COVID-19. Now, a little bit about me. I am a 22-year-old student from Belgrade, Serbia. I came to the United States 2 years ago as a transfer student to study, finish college, and to play volleyball for UNLV volleyball team. After UNLV, my plans are to pursue my volleyball career in Europe. Now, as an introduction, at the beginning of 2020, the world has faced a global health crisis to COVID-19. The first case of coronavirus was identified in Wuhan, China in September 2019. On December 31st, Chinese authorities alerted the World Health Organization that dozens of people have been treated for pneumonia for an unknown source. Soon, this mysterious disease became a pandemic. On March 11th, 2020, the World Health Organization has declared the novel coronavirus a pandemic. Unlike the previous diseases which has surrounded the humanity, COVID-19 caused great suffering and its consequences are enormous. Before the pandemic outbreak, there was various parallel processes that characterized the Serbian labor market condition. According to the findings and report to the UN Human Rights Mechanisms and the European Commission's 2019 Serbia Progress Report, the labor market overall has slightly improved with a decrease in an unemployment rate, but significant obstacles remain in the implementation of employment policies, particularly in relation to the harder-to-employ categories of the population, particularly members of the Roma population and persons with disabilities, as well as women, youth, redundant workers, and other minorities. The emergence of COVID-19 has additionally made the situation worse, thus the position of these categories was extremely difficult, especially for employees in the informal economy. The situation with the pandemic COVID-19 has an impact on a global level, thus Serbia was no exception. Complete lockdown and social distances, which were some of the precautions that the government took in order to reduce the number of infected, impact on the working hour restrictions, and many people lost their jobs. Thus, the economy had been significantly affected. In response to this situation, the government quickly took some measures in order to reduce crisis caused by COVID-19. The government adopted financial packages to support the economy. Serbia has experienced 4 waves of pandemic. The first case of COVID-19 was reported on 6 March 2020, while first death was reported on 20th of March. In Republic of Serbia, women perform an excessive amount of unpaid work, as in the situation around the world. Serbian women work unpaid home duties for an average of 4 hours and 36 minutes per day, whereas Serbian males only do so for 2 hours and 5 minutes per day. While the unequal distribution of unpaid work, especially care work, is significant across all types of families, it is the most common in households with children under the age of 6 and in situations where there are only one or no parents, who are mostly women. Women's economic empowerment is significantly impacted by the difference in caregiving obligations between men and women. Women are less likely to be employed in Serbia than men are, which is in line with global trends. In Serbia, women make less money in both public and private sectors. In practically every area of public sector, working women make less money than working men. In private sector, in almost every area, women are paid less than males. Thus, the banking industry displaying the greatest GPG among all industries. As mentioned before, the childcare responsibilities are one of the most common reasons for women's unemployment. Only 6.5% of respondents of the labor force survey in the Republic of Serbia indicated doing only housekeeping as their primary source of income, whereas 96% of that proportion was female. The results show that women were more affected by pandemic and its measures than men. Coronavirus pandemic also influenced the increase of gender differences and the distribution of responsibilities in a household. Women spend more time in household and taking care of the family. Compared to men, women were more occupied by their child care responsibilities as well with the care of the other members of family and household duties. Thus, a larger number of women were unable to work. Occupation segregation, social insurance coverage, and unequal distribution of care are only few examples of how the pandemic effects on gender-specified employment reflect underlying structural and genderal inequities. Thank you.